Everyone, welcome. Thank you for joining us today for the monthly Strengthening Families Networking webinar. Today we're talking about protective factors and trauma-informed care. My name is Kaylin O'Connor from the Center for the Study of Social Policy. I'll give a few little logistics to start us off, and then I'll share some updates from CSSP. Then we'll have updates from our partners at the National Alliance of Children's Trust and Prevention Funds. Martha Reeder will share those updates. And then we have three different entries within this bigger topic of trauma-informed care and protective factors. So we'll hear from Jeannie Preisler about how North Carolina has integrated the two. We'll hear from Corrine Nunnally at Be Strong Families about their training on living the protective factors. And then I'll share some resources from CSSP about how to take a protective factors approach for caregivers of children who've experienced trauma. So it should be a lot of great information shared today, and we're very excited that so many people have joined us. So I want to give a little bit of background on these webinars. We do these each month. It is an open invitation to those who are using the protective factors framework and coordinating Strengthening Families efforts. And we jointly convene them between the Center for the Study of Social Policy and the National Alliance of Children's Trust and Prevention Funds. While I'm talking, I'm going to actually put up a poll that we would love for you to respond to so that we know what you're already familiar with from the topics that we're touching on today and the organizations that are hosting this. We're actually really pleased to see a much larger number of people register for this webinar today than usual, and so we want to be sure that we're speaking to our audience, and if there are topics that not a lot of people are familiar with, we can give a little bit of background information. So thank you all for responding to that poll. I see the answers coming in. And while you're still answering, I'll just make sure that you're all aware that we do this monthly with a different topic each month, trying to find things that are relevant for those who are implementing Strengthening Families. And then we always post the recordings and the materials, so if you like what you hear today, feel free to go to the website that the Alliance maintains, where you can see an archive of all the past webinars with the slideshows and handouts and everything. I'm going to go ahead and close the poll. We've got lots of responses coming in. Thank you. And let's see if I can share the results so that you can see. 72% of you said you're already very familiar with Strengthening Families Protective Factors Framework, 67% familiar with trauma-informed care, and 56% familiar with adverse childhood experiences. Fewer who are familiar with our hosting organizations, the Center for the Study of Social Policy and the National Alliance. So it looks like people are pretty grounded in what we're going to talk about, but we'll be sure to try to give some context. Martha and I can each say a little bit more about our organizations as we get going for those of you who don't know us. All right, so let's get back to our regular slides here, and there's the link for where you can find, excuse me, where you can find archived previous webinars, and where this one will be once we archive it as well. I put up a couple go-to webinar tips. If you don't do webinars often, you may not be as familiar with this. The take-home message is if you're having trouble hearing, you may want to switch between telephone and mic and speakers. So if you've dialed in and you're not hearing well, maybe you can switch to just listening through the speakers on your computer or vice versa. And if you do call in on the phone, you can enter the audio pin that shows up on your screen. That's unique to you, and it lets the system connect who's calling in on the phone with your name, so that if you wanted to type in a message, raise your hand, we could unmute you and allow you to speak, which we can't do if you call in and don't use the audio pin. And if you do have technical problems, you can type into the question box, and Martha and Trish Hallmark from the National Alliance of Children's Trust Funds and I will try to help you resolve whatever problems you're having. So as I said, we do this every month, the second Thursday of the month at this time. On May 12th, we'll be talking about a related topic, which is a new issue brief that we're releasing soon from CSSP called Working Toward Well-Being, Community Approaches to Toxic Stress, really trying to take a more holistic look at what's going on in communities to prevent potential toxic stress, as well as to work with children and families who have already experienced a toxic stress response. So we're excited about that. It's coming up in about 4 weeks, and you can register already now at that link, which I believe will also be showing up in your chat box on the side. In June, we'll hear from the Alliance's National Parent Partnership Council talking about the work that parents are doing around protective factors in their communities and their states. And then on July 14th, we'll hear about the Early Childhood and Health Learning Collaborative that's really addressing social determinants of health. And Corinne's going to mention that project as well when she talks later in the webinar. So you can learn more about it in July. Okay, so I'm officially moving into some updates from CSSP now. Let me actually say for a moment, the Center for the Study of Social Policy is a nonprofit based in Washington, D.C. We work on a variety of projects that are all related to well-being of children, families, and communities, with a special focus on those children and families who are most often left behind, and communities that are most often left behind. So we work on systems change, policy change, and community change. And I'll share just a few snippets of things that we've done lately that I wanted to update our Strengthening Families National Network about. And I just heard a strange announcement. I'm going to continue as if that didn't happen, but if someone...
Kaylin?
Yes, Trish.
Kaylin, I just wanted to share with you that the last few minutes have not been broadcast, and maybe you want to start over.
Okay.
I was trying to figure out why everybody was saying that they couldn't hear anything, and then I looked up and I saw that the broadcast button had not started yet.
Oh, goodness. Okay. We are going to just back up. Sorry about that. Very sorry about that. I'm going to... Welcome to our monthly Strengthening Families Networking webinar. We're focused today on protective factors and trauma-informed care. I am not sure what happened previously. I know we had people responding to the poll that we put up, so some people were able to hear me, but not everyone was. So, or perhaps just saw the slide come up but couldn't hear me speaking. So I'll cover these topics quickly and try to get into the meat of the webinar as quickly as we can. So today we are, I'm Kaylin O'Connor from the Center for the Study of Social Policy. I'm going to share some updates from CSSP. Then we'll hear from our co-hosts at the National Alliance of Children's Trust and Prevention Funds. Martha Reeder will be sharing some announcements. And then we're going to get into our topic about different ways that people are connecting protective factors with trauma-informed care. So we'll hear from Jeannie Preisler in North Carolina about what they're doing. We'll hear from Corinne Nunnally at Be Strong Families about their training on living the protective factors. And then I'll share some resources from CSSP about taking a protective factors approach with caregivers when children have experienced trauma. So just quickly, if you didn't get to answer the poll before, I don't think I'll be able to put it up again, but we put a poll up asking how many people were familiar with the topics we're touching on today, because we actually had a lot more people register than usual, and we wanted to be sure that with this larger audience we knew that we were giving the right background information. So this webinar happens every month. It's an open invitation to anyone who's implementing the Protective Factors Framework and coordinating Strengthening Families efforts, and we rotate through different topics. So you're always encouraged to join for the topics that are of interest to you, to share the webinar with others who might be interested in a particular topic or who might want to connect regularly if they're very engaged in Strengthening Families work. And just so you know, the recordings are always available at the website here, which Trish has also posted in the chat box. And I'm going to keep moving here so that we make up some of our lost time. If you are having webinar problems, my advice is usually to switch which audio way you're connecting. If you're on your telephone, maybe switch to mic and speakers, or if you're not hearing well through your mic and speakers, dial in and use your audio pin so the system knows who you are when you call in. Or of course, if the person broadcasting the webinar has not pushed some button, then that will be a problem for everyone. So sorry about that, but thanks everyone who pointed out the connection problem. Just a sneak preview of some of our upcoming webinars. As I said, we do this every month. It's always on the second Thursday at this time. Next month, we'll be sharing a new issue brief from CSSP called Working Toward Well-Being, Community Approaches to Toxic Stress. So closely related to our topic today, and I hope that you'll consider registering. You can use the link there and register right away, or if you subscribe to our newsletters, you will get that invitation excuse me, later this month. In June, we'll be hearing from the Alliance National Parent Partnership Council, talking about the work that parents are doing around protective factors in their families, in their communities, and their states. And then in July, we'll be hearing about the Early Childhood and Health Learning Collaborative, which is addressing social determinants of health, again, closely related to today's topic. And Corrine will mention a little bit about that learning collaborative during her presentation later. So when we put up the poll earlier, only about 30% of people said you were familiar with the Center for the Study of Social Policy. So I'll just quickly tell you who we are. We're a national nonprofit based in Washington, D.C. We do work related to promoting well-being of children, families, and communities with a particular focus on those who are most often left behind. So we work in systems change, policy change, and community change. We have the Strengthening Families Initiative, which many of you are familiar with. We also do a lot of other work related to children, families, and communities. We have a strong race equity agenda, and we do a lot of different work. So I'm going to share some updates of things that we've been up to lately and encourage you to look at our website and learn more about what we do. We have been putting out pieces of a Strengthening Families curriculum over the past 8 months, and they're all now released and available. These materials were designed for child welfare workers in partnership with child welfare jurisdictions and systems that were putting the protective factors into use in their child welfare systems. But you can take those and adapt them and use them with any audience you like. I wrote a blog post about it recently, which is a nice way to be able to kind of see a summary of it as well as link to each of the individual modules. Our website can be a bit dense at times, and it can be hard to find your way to exactly where you're going. So starting from that blog post will help you get where you want to be. And when I talk later, I'll be sharing one module in particular that focuses on trauma and protective factors. I also wanted to share a couple of early childhood pieces that have come out recently from the community change team at CSSP. The community change team does a lot of technical assistance for communities that are implementing programs like Promise Neighborhoods and Building Neighborhood Capacity projects. And so they just released a guide to early learning in Promise Neighborhoods, really looking at what those cradle-to-career neighborhoods are doing around early childhood, and a video about what it takes to support that cradle-to-career work. The first video looks at early childhood in Eastern Kentucky, so check that out if you get a chance. And I just wanted to make sure that you are aware of how to connect to CSSP if you'd like to, if you're not currently getting our Strengthening Families newsletter or other newsletters, you can go to that link there and sign up for anything you like. You can follow us on Facebook and Twitter. We're all over the place. So with that, I'm going to hand off to Martha Reeder for some updates from the Alliance.
Thank you, Kaylin. Good afternoon, everyone. I want to share with you first about some upcoming training of trainers events that we have for the Bringing the Protective Factors framework to life in your work. We have a training in Utah, May 17 through 19, in Kern County, California, June 6 through 8, in Madison, Wisconsin, June 21 through 23, and in Columbia, South Carolina, June 12 through 14. I've given you a link there where you can go on our website and see the registration information for these events. Only one of these, the Utah registration, is up right now, and we're hoping that the Kern County and the Madison, Wisconsin registrations will be available to anyone before the end of this week. So please do, and then contact me if you have any other questions or would like to get any more information about the Training of Trainer events. In the next slide, I'm sharing some exciting news that we are working on a Spanish translation of our training materials. And because of a wonderful partnership that we have with folks in Kern County, California, and also in a Yakima, Washington group, especially a wonderful interpreter and translator there named Minerva Pardo, who has given an enormous amount of attention to this over the past few weeks. And we are seeing a lot of our materials translated, and some of those are some of the main pieces like this logic model of strengthening families. And in the next slide you can see also one of the very popular posters that comes from one of our training directors and her work with the Great Start Collaborative in Michigan, Maureen Holliker. So I want to give a shout out to Maureen. And the 5 protective factor posters were translated, but this one, ways to remember the protective factors, that really was developed by parents for parents, is now also available in Spanish as well. And I've given you their website there to look at. In the next slide, you'll see that we at the Alliance have a new series of short 30-minute webinars that are very intensely focused on conveying information from cutting-edge strategies that are out there. And we want to invite you to join us next Thursday on the 21st of April for to learn about the Pay for Success initiative. It's the first statewide initiative like this in the U.S., and it really is going to benefit more than 3,000 mothers and children living in poverty in South Carolina. So please be part of that, and it's just 30 minutes of your day, and I hope that it'll be time well spent. And then finally, on the 9th, Kaylin's already mentioned this, but our Alliance National Parent Partnership Council will be on this call sharing about the amazing work of spreading protective factors in their communities, building protective factors in their families, their communities, and really effectively communicating about protective factors and why they're so important. So I hope you will be here again to join us for that webinar. The Alliance is a membership organization that provides training, technical assistance, and peer consulting opportunities to states' children's trust and prevention funds across the country, and also to their partners and their grantees. And so hope that you will go on to our website, www.ctfalliance.org, and we have many, many resources there, including a free 14-hour online training that is being participated in by over 16,000 people already. And it has, if you're interested in the protective factors and you want to spread that knowledge and in a very efficient way, the online training is a tool that can help you. So thank you very much. And Kaylin, that's all I have today.
So much, Martha. All right, so without further ado, we're going to get into our topic of the day about protective factors and trauma-informed care. And first, we're going to hear from Jeannie Preisler, who's a program consultant with the North Carolina Department of Health and Human Services, Division of Social Services, Child Welfare Section. Jeannie?
Thank you, Kaylin. Good afternoon, everyone. I am really excited to be here today to share how North Carolina has begun to embed the protective factors framework into the trauma work we're doing. I think we still have more to do, but this is hopefully what I'll share will be helpful. I personally am really passionate about this topic. About 20 years ago, I started off as a kinship parent to my 14-year-old biological niece, so I totally had no idea what I was signing up for. And then her best friend entered foster care. So now I have 2 grown daughters, and I'm the youngest grandmother in my neighborhood. But I see how my daughter's traumatic experiences impact them even to this day. And I'm positive had the child welfare team working with me as a foster parent had been focused on building up protective factors for me, I think my experience, and I'm positive my daughter's experiences, would have been infinitely better. So I'm grateful to all of you for taking time today to learn more about this topic, and hopefully you'll see connections on how you can weave the concepts into your agency and community. So Project Broadcast is the name of our trauma-informed efforts in North Carolina. We were extremely fortunate to get a grant from the Administration of Children and Families, and it was a 5-year grant. We were the recipients of the award, but we partnered with the University of North Carolina at Chapel Hill and their School of Social Work for the evaluation component, and the National Child Traumatic Stress Network site, the Center for Child and Family Health in Durham, as our trauma expert. So if you are fortunate enough to have an NCTSN network site or affiliate site near you, I highly encourage you to reach out and collaborate with them. We could not have achieved kind of all that we've accomplished without them as truly full partners at the table. We started this effort in 9 counties. 3 others kind of joined unofficially because some of the other work, but now we're officially expanding to another 12 counties, but in North Carolina we have 100, so we still have a lot of work to do. We've been kind of building on the lessons learned along the way of how we're rolling this out, so it looks different in the last few years, but it's all centered around the National Child Traumatic Stress Network product called the Child Welfare Trauma Training Toolkit. So it's at the heart of everything we've done. So I wanted to get a sense from you guys of how familiar you are with that toolkit. So we have a poll for you. And while that's being pulled up, I'll give you just a basic framework about it. I know it was a labor of love. Many network sites came together, and it was initially published in 2008 and revised in 2013. It's designed for child welfare staff, basically a 2-day-long training, but I think nationally the trend is to really kind of break it up more and do more practical kind of consultation and coaching around it to help workers translate the material into their daily practice. So depending on where we are with that voting, I know Kaylin will probably publish that.
We've got 65% of people have voted. Some votes are still coming in,
Okay.
but let's close it so we can see the results. Most people not familiar with it. Only very few who have actually used it. So most are either not at all familiar or have heard of it but not used it. So your information you're sharing will be very helpful.
Awesome. Thank you guys for filling that poll out. So the toolkit really has about 14 modules in it, and really has, it does have protective factors information in it, but not nearly enough. So in addition to the materials from the toolkit and the Center for the Study of Social Policies, we also used some other sources to reinforce the protective factors framework. So on the next slide, I kind of tell you a little bit about some of the other products we use. So there's one other curricula from NCTSN called Caring for Children Who Have Experienced Trauma, a workshop for resource parents. So we refer to that as RPC because that title is very long. But there's one concept in there in particular, so as it relates to the protective factors, that we talked a lot about before we really did a deep dive in the protective factors, and that was this concept of invisible suitcase. So everyone carries around these invisible invisible suitcase with beliefs about themselves, about others, and about the world around them. And so we found that to be a very kind of helpful lens, because we could surround parents with concrete supports, for example, let's say transportation or child care. But if they're carrying around that belief that the system does harm and everybody's out to get them, I think they're less likely to engage in true partnership, or if everyone in their entire life has kind of told them they're a bad mother and they'll never amount to anything, and they're carrying around that belief, then sharing the knowledge of parenting and child development really can only get us so far. So using the invisible suitcase really helped staff understand kind of why some families might have more difficulty engaging that system. Another NCTSN product they have a birth parent series, and this is a very cool series in general if you're not familiar with it. They have actual flyers to give birth parents, flyers for social workers, flyers for mental health professionals, etc. But they have a case example in there, and her name is Karen, and we really framed everything kind of around Karen. And in the handout section, you have a handout that says, "Let's meet Karen," and this is just a beginning of kind of how we introduced this material. We kind of had them read Karen's story and think through what they might do related to case planning, but then kind of after they've already done that, we had them actually plug in that case planning into each of the protective factors and really think through how they might, what tangible things would they do within each protective factor. So most of the staff really found this very helpful, and I know the hand model was used to help parents and everybody remember the 5 protective factors, and you'll see on the handout, the Let's Meet Karen handout, I actually put the word incredible in front of social connections, just because we're building incredible social connections. But that makes the acronym PICS, so P-I-C-K-S, which is easy for a social worker to remember, kind of just building on the fact that a family can actually pick themselves up if they have all these protective factors around them and navigate this very complicated system. So if the hand model doesn't help, potentially that mnemonic might. But so on the next slide, I go into a little more resources that we use to help reinforce these concepts. So one is the Healing Need video. So many of you may be familiar with this, but Healing Need is a 54-minute documentary about the life of Tonya Kane, and Ms. Kane has extensive trauma background as a child and as an adult, and really struggled for years with drug addiction, but is now really just thriving and helping to educate the masses about trauma and effective treatment. The video has her interacting with her birth mother and has discussions about her with kinship caregivers when she was young, and there really is just some really rich examples of where protective factors could have been used to really help her navigate the system. So we kind of use that as another kind of tool in our toolbox. So the modules of the toolkit, specifically module 9 and 10, you see there it's all about enhancing the child or family well-being and resilience, and that's a natural fit for protective factors. Again, it has some material about protective factors, but we wove in the Strengthening Families framework and just made it a much stronger material to be trained. So we really did kind of a much deeper dive, so to speak. But my favorite kind of all-time thing that we did was in the very last module of the toolkit. So you have just spent 16 hours with a group of child welfare professionals, teaching them about brain development and protective factors and how trauma manifests itself and evidence-based treatments. You've just taught them a lot of information, and so Module 14 has a kind of case culmination activity. So they, in a small group, really take all this knowledge and look at this case and apply it. So they actually come up with a fabulous kind of evaluation of this situation and a great case plan, and truly are very proud of their work, as they should be, kind of because they really have put a lot of time and effort into this activity, and after they've kind of debriefed and reported out, we then say, okay, now plug in those that case plan into the 5 protective factors and see if there's any gaps. And there was just aha moments kind of happening all over the place. Just like, oh, there really is a gap here, you know, and one social worker even just kind of said, like, no wonder they keep coming back through our system over and over again. We are their only social connection. And so I think that, again, just kind of made it really practical for them, and help reinforce the principles. Now, so we're at the phase now where kind of we've taught these principles, and we have to see how it translates into practice. So we're doing that consultation and monitoring and some coaching along the way. But I think we're not completely done by any shape, but we've started, and I think that it's a very good marriage, the toolkit and the protective factors framework, to really overlay them and blend them together. It I think has just made a tremendous impact for the kind of knowledge, skills, and competencies of our workforce. So that's kind of where we're at.
Thank you so much, Jeannie. I think that's really interesting, and I think it's great to see more connections being made as we have all these conversations about trauma-informed care and realizing the role that a protective factors approach can have in that work. So to continue on that theme, we're going to hear from Corrine Nunnally at the Be Strong Families in Chicago, and Corrine's going to talk about their training living the protective factors. Corrine, are you there? It looks like you may have muted yourself. Okay, let's see if I can unmute you. Nope. It looks like you're muted on your phone, Corrine, so I'm going to talk for a second.
Oh, hear me now?
Yes, we can hear you now.
Okay, great. I love technology. It's a beautiful thing.
Yes, it's fun. I want to take a moment, actually, before we jump into your presentation. I see that one question came in about whether this is evidence-based. And so, Jeannie, can you address the evidence base of the NCTSN toolkit and how you built in protective factors within that evidence-based toolkit?
Sure. I think that I don't know that the National Child Traumatic Stress Network would say it's evidence-based. I think that it's evidence-informed, and it certainly has the science, the new knowledge that we have now about brain development, and certainly there's a module kind of on working with your mental health community and engaging them in evidence-based treatments. But I would say the toolkit itself is evidence-informed. More than an evidence-based curricula.
Okay, thank you for that clarification. And of course, we know the Strengthening Families protective factors are also evidence-informed. And so lots of good knowledge and research behind the concepts in both cases, and bringing them together, then you're not messing with fidelity of a particular piece, which is also great. And thank you, Casey Cox, for typing in that question. I know we've had other questions coming in, some about technical things, which Trish is responding to right away. There were a couple about the Strengthening Families curriculum, which I will get to after Corrine's presentation, but feel free to type in other questions, and we will be happy to answer them as we go. So now I'll hand it over to Corrine. You can do your presentation, and we'll see if there's any more questions after that.
Okay, great, thank you. Good afternoon again, and thanks again, Kaylin, for the opportunity to be a part of a really important discussion, as Jeannie indicated earlier. I've been excited about this work, having been in the child welfare role primarily for the last 25 years, and was introduced to the protective factors when I became Director of Strengthening Families at a child welfare agency here in the state of Illinois called One Hope United. And my role was to embed strengthening families within the early childhood and child welfare programs within that organization. And I fell in love with the protective factors before I even got the job. I really saw them as the key to strengthening families and empowering the staff with tools to engage parents and families as they were helping them to rebuild their lives within the child welfare community. So moving to the second slide, while we were Strengthening Families Illinois prior to becoming Strengthening Families, we began to recognize that ACEs and toxic stress was a major factor with the families that we were working with. And so we decided that we were going to incorporate a sample of the ACEs quiz as part of the training, in addition to sharing the truth about ACEs. There's often a concern from parents about passing toxic stress to their children, or wondering about the impact of their ACEs in terms of the impact they might have on them, or they're wondering why they're okay. You know, despite the things that I've experienced, I took this exam and I'm at an 8 or I'm at a 4 or at a 3, you know, why am I still okay? And the answer is the protective factors. And it's been very helpful to parents and to people when we presented the idea of toxic stress and trauma to families in this way. In the next slide, you'll see that we began to message that the protective factors is the way to mitigate toxic stress in families. And this has been critical in terms of how we think about toxic stress and ACEs and how we approach the work. We acknowledge that this has happened to us. We acknowledge what's happened to us. We acknowledge what's happening to our families. We know that toxic stress and ACEs, adverse childhood experiences, discussions can be a downer, and the conversation does come up. But being able to provide the protective factors to our parents as the alternative has always been well received. In addition to doing this in the training, we're able to highlight that families are already living the protective factors. And going through this training allows them to build and reflect on how the protective factors are alive in their home, as well as them being a little bit more intentional. And if you go to the next slide, you know, this provides kind of a picture of this is what your home looks like. You know, you have all these protective factors that are working on behalf of you, and it's strength-based. And in doing that, you're mitigating the effects that toxic stress or the trauma has had in your life. The Living the Protective Factors is a different training than some of the other protective factor trainings we've done. It was developed in response to parents' requests who wanted something deeper. It was developed with parents, and it's delivered by parents, especially because parents have always been our primary audience when we're thinking about the work. We're always thinking about how are parents going to get this information? How is this going to be a process where they become empowered, they continue to be leaders in the process of healing their families, and we continue to work in partnership with them. Living the Protective Factors and reducing toxic stress by living the protective factors are structured in a way where we don't introduce the protective factors without first introducing ACEs and toxic stress. And again, for a lot of people, when it's conducted this way, the protective factors is immediately relevant. We talk about going on a journey and really understanding, you know, where you are, what are the protective factors, and how do the protective factors relate to where you are, and how do you build on that? The training has gone through some changes depending on the audience and has also been adapted to meet the needs of child welfare. So we have an adaptation, which is living the protective factors in child welfare work. And some of the learning objectives that are specific to the child welfare audience is that we help them understand the framework as instrumental for advancing the core child welfare goals around safety, permanency, and well-being. We do a review on what toxic stress and trauma and ACEs is, as discussed before, and help them understand how the protective factors can help mitigate those negative impacts, as well as them being part of a trauma-informed practice within child welfare. We relate the strengthening families' protective factors to their own lives, and that's one of the unique things that I've always loved about the trainings that we provide, especially on the professional or staff development level, is that we really get staff to understand, what does this look like in your life? How does this apply in your life? We really believe that there's an opportunity through self-reflection and peer-to-peer learning for staff to develop a level of empathy and to really think differently about how they're approaching work as it relates to families that they're serving. And then we're also providing some practical insight and strategies on how to assist child welfare involved families in building the protective factors and helping them to think about how they're infusing them into the child welfare service plans as they're working through the plans with their families, be them individual plans, family case plans, or the various terms that are used around the country as it relates to family plans. With all of this discussion around ACEs and toxic stress and trauma, we were really excited about the opportunity to talk about toxic stress and living the protective factors through a collaboration that we did with the American Association of Pediatrics and the National Head Start Medical Home Learning Collaborative. And I know that Kaylin's going to give a little bit more detailed information about what that is. But we were part of the Learning Collaborative, which was covered over 6 sites. And as you can see, from Chicago to Dallas, Seattle, Georgia, Howard County, Maryland, and Salem, Oregon. And it was a really great opportunity to begin having this dialogue with parents to help them understand that, you know, despite the fact that this is happening, you're not hurt, you know, you have an opportunity to build a framework and to build protective factors and to intervene. We don't want to give the full message of stop, you're hurting your child's brain, right? We don't want to scare our parents, but we do want them to understand that toxic stress does have an impact on brain development, but there is an opportunity to mitigate those circumstances. And how do we do that? It's through the protective factors. So another way that we're able to introduce the protective factors and help parents build those for themselves is through the parent cafes, which is a strategy where, again, there's the opportunity for peer-to-peer learning and self-reflection. And that's on the next slide, where they can build protective factors. And so what we find is that parents who come to the cafes want protective factors, and those who want protective factors want more cafes because it provides the continuing opportunity to build the protective factors that they're learning about to address some of the trauma and the stress that they find themselves dealing with and feel empowered to mitigate those circumstances as they're working towards strengthening their families. So that's pretty much how it goes for me. I see that I have a question, so I'm not sure if I should go ahead and respond, or Kaylin, if you should share it with the group first. So I'll just stop here.
I'll read the question and then you can answer it, which would be great. Monica Nolasco asks, what kind of language do you use with parents? We are considering finding different language to communicate the protective factors with parents. And I know that's an area that Be Strong Families has a lot of experience, so feel free to history there.
Sure. Well, let me, of course, do a shameless plug, www.bestrongfamilies.net for more information. But yes, early on, we did, because of our approach to ensure that we were parent-friendly and that we were always thinking about parents, when we were introduced to the protective factors, we did decide that we had to identify parent-friendly language as it relates to the protective factors. So, for example, resilience is introduced to them as being strong and flexible. Social connections is being introduced to them as parents need friends. Knowledge of parenting and child development is parenting is part natural and part learned. Support, concrete support in times of need, is identified as everybody needs help sometimes. And then finally, the social and emotional competence of children is introduced as helping children communicate. And so that's the language that we use when we introduce the protective factors to parents.
Thanks, Karine. And Monica, as an additional response to that, I can share that I know in the Alliance's online bringing the protective factors to life in your work, in that training there is a point that shares other ways that other initiatives have reworded the protective factors. It's actually been quite an interesting and affirming process to go through with parent groups to say, well, how would you say this? I know in Alaska they talked with Native Alaskan parents in rural areas about what does this protective factor mean to you, and how would we say it in a way that would resonate with other parents in your community, and they came up with other ways to describe it. So that process in itself can be a great experience for parents, and then you can come up with something that's how you want to communicate it in your community. Okay, well, thank you so much, Karine. And I don't know, have we had any other questions come in that we should answer right now, or should we? Let's see. Okay, so I do see there are a couple questions. The link you can go to find how Be Strong Families talks about the protective factors is bestrongfamilies.net. And you can also look at ctfalliance.org to find the online training that goes into some of that as well. And then there's another question here, Karine, that says, how do you target parents? So I guess for offering that Living the Protective Factors training, how do you find the parents who would participate?
Sure. Oftentimes, the trainings that we offer to parents have been organizations who are looking at building the protective factors, using the training as an opportunity for parent engagement and parent leadership. So the majority of the times, that's how we've been able to provide the training to parents, is organizations contacting us and asking us to come in and provide the training for parents that they're servicing.
Great, thank you. And I will also read a plug that we got from Ruth Atkins, who writes, we've had 24 of our local people trained, and we've been having parent cafes locally for a year and a half, at least once a month. Our community and partners love them. So that's a nice endorsement from a participant.
Thank you.
All right.
So
go ahead.
Yeah, I'm sorry. And adding to that, I wanted to share with the individuals who might be interested in having their staff trained on parent cafes as a way to help them build protective factors and provide an opportunity for peer-to-peer learning, parent engagement opportunity. We do have several parent cafe training team institutes scheduled around the country, regionally, East Coast, Midwest, West Coast, and I think there's still another Midwest one between Wisconsin and Indiana and Illinois. So you can find that information online, again, at our website. And thank you, Ruth. I'm really excited to hear that the parent cafes are going well, and I'll pass the information on. Thank you.
All right, thank you so much, Karine. We have about 10 minutes left, and I'm going to share some resources from CSSP specifically about taking a protective factors approach for caregivers of children who have experienced trauma. Another angle on this. I mentioned our Strengthening Families curriculum. I'll say a little bit more about that now. And if you look in the handouts in your webinar panel, you'll see there is one there about it's called CSSP SF Curriculum Overview. So that will give you an understanding of what this full curriculum is, as well as a link to get to the materials. I'm going to focus specifically on Module 4, which is called Trauma and Brain Development, a Protective Factors Approach. As with the other modules in this training, it was designed for child welfare audiences, but I think it would apply for many other audiences as well, and you are free to use it and adapt it. You can use it to provide a pretty basic grounding, a good basic grounding in early childhood and adolescent development, why we're particularly concerned with those critical periods of development, and then why trauma matters and how to support caregivers. If you're in a situation where people, you're working with staff who already have other training on trauma, you might just want to pull the protective factors content for those participants. And so I'm going to show you those slides so you can understand what we're talking about. This is the list of the learning objectives for that module. It goes through early childhood brain development, the importance of a nurturing adult, adolescent brain development, how stress affects children and youth, the cascading impact of child abuse and neglect if not mitigated, signs and symptoms of trauma at different ages, and then the last section is about protective factors approach for caregivers. So we look at what the challenges are for caregivers when they're caring for children who have experienced trauma, because we know that those parents or caregivers are going to be dealing with more externalizing behaviors, possibly testing of caregivers, less of the positive feedback that is what makes parenting survivable, that we all need that to get those positive responses. You may get less of that when a child is healing from a traumatic experience. And also knowing that these children may not respond well to typical disciplinary approaches, and what worked with other children may not work with children who have a traumatic experience in their background. So trying to look at what that means for the protective factors of caregivers so that we can identify the right supports to give them. So I'm going to show each of these slides. I'm not going to talk about them each as much as we would in a training, but just so you can see with parental resilience, what are we thinking about with parents as we think they may be caring for children who have been through trauma. So what does that tell us? They're not getting the positive feedback. They may feel less personally resilient because their parenting is not working the way it used to, whether they've raised other children in the past and now they're raising a child who is responding very differently. That can undermine your sense of resilience and self-efficacy. There's a particular challenge to resilience for caregivers who feel some responsibility for the trauma their children have experienced, whether that's that they actually caused their child some harm and they are healing their relationship as well as dealing with their child's behavioral reaction to that, or if they feel that they failed to protect their child from a situation where they, rationally or irrationally feel that they could have protected the child. So there's a lot of challenges to resilience there, and we need to be very aware of that. Then we go through social connections, what it means for your social connections when you're raising a child who's not responding the way other children are or who's having particular externalizing behaviors, and how to develop social connections that are going to be supportive of what you're doing, and the strategies that you need to use, which may not be the social connections you had previously. And also the bottom point there about providing tools to help them educate their extended families and other social connections so that they'll have a better understanding of what is going on with the child they're caring for. Knowledge of parenting and child development. I'm going to go just have these show on the screen without talking too much about them because we need to get to some other topics as well. But basically, I hope you'll see how these slides could be useful for people who are already understanding trauma and perhaps are already understanding protective factors, but need some help linking them in their work. And finally, the social emotional competence one. Just going through all of these. So I hope you'll find that useful, and please feel free to contact me if you have questions about the scripted curriculum. We call it the scripted curriculum. It's not, you don't have to stand and read the script, but we do provide the slides and suggested script for trainers so you know sort of the points that should be made with each slide. Okay, and then another thing that you'll see in your handouts is a tool we developed called Self-Care for Kinship Care Providers. This was developed in partnership with people from jurisdictions that are using strengthening families in their child welfare systems, and I know Jeannie was part of that group, and her experience having been a kinship care provider as well as working in the system was really helpful for making sure that we were talking to people in a way that made sense. And so we've formulated this it's not just for formal kinship care providers, but also for others who may be informally caring for a child from their extended family. We go through each of the protective factors and look at what they can do to support their child and to take care of themselves. It's not limited by the child's age, so we've put it out under both our Strengthening Families and our Youth Thrive banners, Youth Thrive being the parallel framework of protective and promotive factors for youth. And really, we hope that kinship care providers will find this tool, whether they're given it by a caseworker or if they find it on the internet, but really talking about how to be mindful of your own protective factors. It includes a trauma tip, sort of how this may be different because the child that you're caring for is quite likely has experienced some kind of trauma to be having been removed from their parents or be living with kin. So we hope that that is a useful tool and encourage you to use it. And then I also want to share a little sneak preview of what we'll be talking about on next month's webinar, which is closely related. It's an issue brief that we're releasing very soon called Working Toward Well-Being, Community Approaches to Toxic Stress. And the idea here is similar to what we've been talking about today, that with our increased knowledge about brain development and about the importance and the impact of trauma and toxic stress, we haven't yet been really good as a field at connecting that to other work going on in communities to improve children and families' well-being. And so we worked with a group from our Early Childhood Learning and Innovation Network of Communities to talk about what's going on in their communities that prevents and responds to toxic stress, and how our work, many of us have been working in the prevention field for many years, and the knowledge of ACEs and toxic stress intensifies, sort of underlines the importance of that work, but that prevention work hasn't often been connected to the more responsive things that have developed in response to knowing about toxic stress. So we'll be sharing this new framework and issue brief on next month's webinar, and I hope that many of you will be able to join us. So I wanted to see if there are any more questions that we should respond to before we sign off for the day. I see a couple of comments. Sorry, just scrolling through. I want to be sure that this recording of this webinar will be posted on CSSP's website as well as the Alliance's Google site, and the PowerPoint slides will be there as well. And I see that someone asked for the language to be repeated again. Corrine, would you be able to repeat how you rephrase the protective factors for parents? Oh, we can't hear you if you're speaking, Corrine. There you are.
No, I'm here. I have to unmute myself. Sure. Can you hear me now?
Yes.
Okay, sure. Resilience is being strong and flexible. Social connections is parents need friends. Understanding parenting and child development is parenting is part natural, part learned. Concrete support in times of need is everybody needs help. And emotional social competence is helping children communicate.
Great, thank you. And again, you can look at bestrongfamilies.net to find more information about that. I see someone asked about the Alaska materials as well. They put out some posters. I think if you go to Strengthening Families Alaska, they have a Facebook page and possibly also a website where you can find the posters. If you can't find them, let me know and I can send them to you. So with that, I think we're at the end of our time. I want to thank everyone for joining us. I've got my email up here and Martha's in case you want to contact either of us. And Corrine has also put her, I believe her email is in the chat box. And feel free to contact any of us with questions. Thanks for participating. A survey is going to pop up when the webinar ends. If you could answer that either right now or when you get the follow-up email, we would really appreciate it. And hope that we will all be in touch again soon. Thanks, everyone.